Hello and welcome, everyone. Today, we have a special treat for you as we sit down with two incredible individuals who not only bring their expertise as registered dietitians, but also showcase their entrepreneurial spirit by combining health knowledge with creativity in their businesses. Please join me in welcoming Amber and Larissa. Let's start by getting to know you both a little better. Amber, could you share a bit about your background and what inspired you to pursue this path?
Hello everyone, I'm Amber Brown McFadden, a registered dietitian nutritionist based in the Dallas-Fort Worth Metroplex. I've worked in research for the past 12 years on multiple contracts focused on the dietary assessment, food acquisition, and food prices in federal food and nutrition programs. For over 20 years, I've also been a freelancer, specializing in photography, artwork, and custom-made clothes, jewelry, and accessories.
That's really fascinating. And Larissa, how about you? What led you to become a RD, and what experiences shaped your journey towards entrepreneurship?
Hello all, I'm Larissa Loftman, a registered dietitian, certified lactation counselor, and certified clinical research coordinator based in the Research Triangle, North Carolina. I've worked for many years in the maternal and child health, community health, and research fields promoting population health in underserved communities. Over the last year, I launched my wellness business, the Global Harvest RD, to empower adults to live their healthiest, happiest lives through nutrition, gardening, and travel guidance.
Hi Larissa, I'm excited to be talking with you today.
Amber, I'm excited to chat with you today as well.
Amber and Larissa, how did you meet one another?
We met in graduate school. We were in the same dietetic internship and graduate class at the University of Texas School of Public Health.
Yes, back in 2010 at the Houston campus. We spent a lot of time together with our classmates exploring local places, working on school projects, and socializing. I'm glad that we've been able to keep in touch over the years. I especially appreciate being able to talk to you about a difficult situation I experienced during my clinical rotation, and you being very supportive about that.
I remember you always being calm and collected. Even then, we had a lot in common with our interests in nutrition and research. We both were graduate researchers doing similar work. What was your favorite grad school memory?
The entire program was very challenging, but we had a lot of good times together. I think that the one time we had a Thanksgiving potluck was really nice. That's my favorite memory.
Yes, I think our schoolwork and internship kept all of us very busy, but we still found time to spend together. We really enjoyed bonding with our internship class. Every one of them were extremely smart and motivated.
Absolutely.
So shifting gears to your career paths, Amber, can you give us a brief overview of your career so far?
Sure. While I was a graduate research student at UTSPH, I applied for a job opening as a dietary coding supervisor at Westat, an employee-owned research company. I applied for it, and I've been there ever since, and I wanted to work in public health, a field that impacts a lot of people to help improve their lives. The motto at Westat is improving lives through research. The research group that I'm a part of focuses on research supporting federal nutrition programs, which are the most far-reaching programs organized to reduce hunger and promote healthy nutrition throughout the country. The research we do helps to quantify how far that reach is and just how much of an effect these programs have, which is essential to their existence.
It's really cool that you have been in the same company since we graduated. Can you talk a little bit more about your current position?
Sure. Right now, I'm a senior research associate at Westat. In my line of work, Roles often shift according to our research needs, but I mainly serve as a supervisor in the dietary assessment team, where we focus on dietary assessment, food acquisition, and nutrient database projects. Essentially, our company collects data about the food that people choose. Our team trains data collectors to contact people in the study. After that, we categorize the food data into quantifiable measures and create reports that estimate nutrient intake for the study population. We also do research connected to food prices. Over the years, we've completed a lot of different studies with different data collection methods via websites and mobile apps. Right now, I won't get into the details, but feel free to contact me if you're interested about learning more.
That sounds so interesting, Amber. Thank you. Larissa, can you tell us about your career path?
My first position as a registered dietitian was for the Women, Infants, and Children program, also known as WIC. This was a great experience that helped me build expertise in the areas of maternal and child health, lactation support, and community work. During that time, I served as a county leader for a statewide initiative to reduce infant deaths and promote women's health. That work led me to accept a position at Cincinnati Children's Hospital, where I led a community-based program to improve health in underserved communities. I also later shifted to a job conducting community research with the same goal: help families in need. My research expertise helped me land work as the Family Medicine Research Manager at the University of North Carolina, UNC.
And now you have started your own wellness business. When did you decide to make the jump?
Yes, I contemplated the career change for a few years prior to actually launching my business. After years of work in nonprofit and community settings, shifting to work as an entrepreneur was a huge change for me. I think we all realized during the pandemic that life is short and we shouldn't be afraid to pursue something we want to do. This is one of the main reasons I decided to go for it.